Hello everyone, this is Dr. Vikrant Shah from Zen Multispeciality Hospital Chembur. I am a physician, intensivist and infectious diseases specialist practicing here. Today here I am going to talk to you all about a very basic and very common topic called as vitamin B12 and vitamin D3 deficiency, or we may call it as the role of vitamin B12 or D3 in our day-to-day life. You will be surprised that vitamin B12 and vitamin D3 carries such an important role in our life. So we need to understand why it is so important. If we really look at our body from top to bottom, vitamin D3 and vitamin B12 plays an important role to have the harmony for entire body system. To give you all example, if we have deficiency, what are the symptoms we face? So symptoms, if at all I have to speak about B12 deficiency, let's start from top to bottom. So we have head. So we have premature graying of hair, which you can see because of B12 deficiency. You can have significant hair loss because of B12 deficiency. Resting to head alone, we can have confusion. We can have memory problems because of significant B12 deficiency. We can have visual problem, what we call it as macular degeneration. If not identified on time, you can lose eye because of B12 deficiency because of severe macular degeneration. There are reports premature cataract developments are also associated with B12 deficiency. Your skin color changes and the basic skin potency and the texture of the skin is also dependent because of B12 deficiency. Then you can have memory lapses, as I can say. You can have a scholastic backwardness in children because of B12 deficiency. You can have tingling sensation in the body because of B12 deficiency. You can have brittle nails, you can have nail textural abnormalities because of B12 deficiency. So there is lot depend on B12 deficiency. There are serious conditions wherein patient can get into psychosis, what we call it as Korsakoff psychosis in B12 deficiency. You can have a spinal cord involvement, what in medical language what we call it as subacute combined degeneration of the cord. You can develop paralysis because of B12 deficiency. So it is very important in our day-to-day life. So if we identify any of such symptoms, it is better to meet your doctor, get your B12 tested and take the treatment accordingly. Coming to vitamin D3 also carries a lot of importance in our life. We being now into the corporate era in the world and what has transpired over 2 years of time because of COVID, because of the lockdown, we hardly got exposure to sun. So sun carries a major chunk of role in providing you vitamin D. It is also available in the lesser content into day-to-day your dietary products, but the maximum D3 is absorbed from sunlight. The best time to take vitamin D from sun is from 10 am to 3 pm. Now why 10 am to 3 pm? It is the time wherein you have maximum UVB rays from where you get vitamin D. Now what happens in vitamin D deficiency? Vitamin D deficiency is associated with bone pains. You can have problems with low back pain. You can have problems in all the joints. You can have myalgia, what we call it as muscle pain. So this is very significant. Vitamin D3 and vitamin B12 deficiencies of which are also associated with chronic illnesses, like your immunity goes down. So you are falling sick on and off. You are getting recurrent respiratory infections. All this is associated with deficiencies. There is a data wherein D3 deficiency is association with depression, anxiety. So it's a multi-system problem you can have. So that is why it is always better to identify this deficiency. Thank you very much.